live from our partner Nation Talk in their studio offices. And this is another COVID-19 virtual town hall brought to you by our partners, the Indigenous Physicians Association of Canada. Thank you to the doctors, to everyone keeping our nation safe, and for making the time during this global pandemic to inform all of our listeners and our viewers about what's happening in our nation surrounding COVID-19. If you have questions for us today, we have four amazing physicians all representing us and willing to take questions. We've got 2 hours to unpack. So send those questions to fnhma@ihtoday.ca. My name is Marian Crow. I am the Chief Executive Officer of the First Nations Health Managers Association, and we are so delighted to be partnered with Indigenous Physicians Association of Canada to be giving you this information. So thank you, everybody, for joining us today from your territories, your nations, and welcoming us into your homes, offices, and organizations. So, shall we begin? Are you guys ready, everybody out on the airwaves and watching us on Facebook platforms? Let's roll up our sleeves and talk about vaccines, the myths surrounding them, and don't forget, send those questions once again to fnhma@ihtoday.ca. Dr. Evan Adams, come on in to the Crow's Nest, my co-host for today.
Marian Crow, so nice to be with you today, and thank you so much for having us. I love that today we can spend some time with Indigenous our communities, and we have such a nice group of colleagues here to talk about the many different issues around COVID in Indigenous communities and in Indigenous individuals and Indigenous families. And so thank you to our guests. We'll introduce them in a moment, but I did want to just remind the listeners about where we find ourselves. It's been quite a 20 months. The world has changed from what it used to be. And the situation today is 687 Indigenous communities in the country are looking at vaccine clinics and getting their peoples vaccinated because of COVID. There have been 804,000 doses as of October the 19th administered in our communities, of which 358,000 were second doses, age 12 and older. Over 94% of those age 12 or older in First Nations, Inuit, and territorial communities have received at least one dose, and over 75% have received a second dose. And remember, that's just a generalization over the whole of the country. There are definitely places where that vaccination rate is higher, and definitely there are places where that vaccination rate is lower. And data has shown that Indigenous people living off reserve and in urban areas have worse health outcomes compared to those living on reserve. And additionally, most Indigenous communities are comprised of younger age groups, making the upcoming pediatric COVID-19 vaccinations a very important part of reducing transmission. And there, of course, as always, there are lots of factors that are a part of the clusters and outbreaks that are happening in a couple of hundred communities today. The number of communities ever affected, Indigenous communities ever affected, 499. That means that most of our communities have had very direct experiences with COVID, and all of us here, and I think everyone who's listening really wants to do their best to try and help our communities. So let's start to meet some of our guests. Our first guest, it's really a pleasure to introduce Dr. Lisa Richardson, who's an Associate Dean in Medicine at the University of Toronto and an Associate Professor in the Department of Medicine. She did her MD at the University of Calgary, where she was my classmate. And she is the chair of the Indigenous Health Committee at the Royal College of Physicians and Surgeons of Canada, amongst many other titles. So, Dr. Richardson, let's throw it to you.
Miigwech, Evan, and it's just so cool to be on this panel with my buddies here, and Marion to have that incredible introduction. So what an honor, and to be speaking to all of you and have people tuned in to chat. So when I spoke to Marion about what to speak about, she said, well, let's just talk about why you should be getting vaccinated, why we all should be getting vaccinated, and talk a little bit more. I'm going to open the conversation around some of the data around why this vaccine is safe. And for those, thanks for that warm introduction, Evan. Really honored to be here. I'm on in Takaranto, so the same traditional territory where Marion is speaking from. My traditional territory is about 4 hours north of here, Shebananing, Killarney, and that's my Anishinaabe roots on my mother's side. So when I think about COVID vaccines, and I think about it in the context of Indigenous medicine and Indigenous well-being, I think about how our traditional ways, when I think about Anishinaabe teachings, are so much about prevention, and how we need to be considering always trying to be well and working on our wellness, how we have done that traditionally always, and how the vaccine is now a tool that we have to enhance that. It does not mean that we're not doing all of the other forms of prevention that our elders and traditional healers may be speaking to us about. The physical activity, the ceremony, the teas, whatever your plant medicines may be that you may choose to use. But I see vaccines as another very critical component of prevention. And what do these vaccines prevent? You've all probably heard about the most common variant that we now have, which is Delta. We know that the Delta variant moves very quickly. It's more contagious, it's more infectious. And some people have expressed concerns, well, why should I get these vaccines? Do they actually work against this newer form, which is now what we see comprising all of the COVID, almost all of it? In fact, the vaccines do still work very effectively, and they work to prevent severe disease. So they prevent hospitalization and they prevent death. Really heavy, I realize, but important to acknowledge. So you may still get COVID if you've been vaccinated, but it's likely just going to be a small cold. So you're very unlikely to actually be admitted to hospital. And I can tell you, I've cared for many patients with COVID in hospital, and it is very devastating to observe people having difficulty breathing, not getting severe pneumonia, and ending up being on life support and in the intensive care unit. So the vaccinations will actually prevent that. When I think about vaccines in that whole prevention framework and how we are taught to think, I think about the collective too. We are being vaccinated, even though you may be very well, because you may be living close to people who have other medical conditions that would put them at risk of severe infection. People with diabetes, for example, have a much higher rate of having severe COVID. People with other immune conditions have a much higher risk of having severe COVID. People who are over the age of 60 actually are at risk of much more severe infection, and people who are pregnant are at risk of severe infection. So I see, and let alone our youth, our little ones who are not able to be vaccinated yet. So I see this as very much a part of how do we consider maintaining our health and well-being and preventing those bad outcomes that can happen. I want to talk for a moment, Marian, just about the safety of the vaccines and what we know. You know, at this stage, millions of people around the world have had these vaccines, millions. And we track the reactions to it are very, very closely tracked. The thing that we have to be most concerned about is what's called anaphylaxis, which is a severe allergic reaction. The likelihood of having that is between 2 and 8 people out of a million vaccinations. So that is a very, very low risk. The reason we observe people after they've had the vaccine is if ever you were to start to have an allergic reaction, we can actually treat it. There's medication that we give to reverse that allergic reaction on the spot. And then we would observe and monitor. And in fact, some of the newer guidelines are saying that people who've had a severe allergic reaction can actually go on to have a second dose if it's in a safe and controlled environment, but they need to see an allergy specialist first. So I'm just pointing that out. That is what we worry about. And even that is something that we closely monitor for and we can treat. The second piece, most people who've had the vaccine will say, you get a headache, you get a sore arm, you get some muscle aches and pains. They're really minimal symptoms. They are common, but they're very minimal when I look at the protective effects of this vaccine. Lastly, I want to talk for a moment about the vaccine safety in pregnancy. We now have a lot of research about this, not just at for patients. We've got a registry of 35,000 patients between the US and Canada pregnant women who've been vaccinated, not a single bad outcome related to this. And then we have lots of studies, actually, when they look at doing the scientific research on rats and other animals, they show that there's no change in fertility, no effects on the fetus or on the embryo. So really we're looking, and because you can get very severe COVID with pregnancy, I've seen too many pregnant women in the ICU with severe disease. We really, the Society of Obstetrics and Gynecologists and many other specialists are all promoting and encouraging people to be vaccinated during pregnancy. So I'm going to leave it at that because I think I've gone through my time. I hope that gives a little bit of an intro around why to consider this.
Thank you so much, Dr. Richardson. And I know you're with us for a small window, so I'm going to deviate from that agenda that we have and actually ask you a couple of questions right off the hop, if you don't mind, Dr. Richardson. So you talked about treating some of those COVID patients in hospitals. Do you want to share with us why it's important that we know about what's happening in the hospitals, especially when we look at our colleagues in Saskatchewan and Alberta? What's the relationship between those hospital rates and why we need to be concerned about those? If you don't mind tackling that one, I would so appreciate it.
Yeah, thanks, Marianne. That's an excellent point. So what we see is that because I was talking about the evidence around how these vaccines, if you are vaccinated, you're less likely to go to hospital. What we're seeing is that people who are hospitalized with COVID, almost all of them have not been vaccinated. And when we have areas where there are many people who are not vaccinated, we have more and more people who are ending up in the hospital. And unfortunately, this means that the resources are becoming limited. So that if you end up in the hospital, it's a concern that will you be able to get the treatment that you need? Will you be able to get a bed in the intensive care unit? And in both Saskatchewan, I remember just a few weeks ago, we were told here in Toronto that we would be accepting patients from Alberta because the intensive care unit was full. So we're seeing the ripple effect of having full ICU beds and then people having to travel far away, be transported far away for care. The other piece that we're seeing is when those hospitals are being filled up with patients with COVID, the other care that's really important is having to be postponed. So I've been talking to people who've had their surgeries for cancer postponed, their surgeries for implantation of like pacemakers and other heart surgeries, et cetera, having to be postponed. So it really, if we look at the prevention, it's not just the effects of COVID itself, but on the healthcare system more broadly.
Thank you so much for unpacking some of that messaging because let's face it, if we are in a critical accident or if a heart attack happens or anything that requires urgent care services, we may not have the capacity within our health service delivery organizations because of those rates that are in hospital now. And I can speak to that as well. I'm a board member for the Ottawa Hospital, and we have 3 hospitals. And making those decisions about who is going to get the much needed intervention is a decision that hospitals do not want to make at this time. So again, it's a tool for all of us. We wanted to ensure that you are hearing from credible, reliable sources of information today. We have an all Indigenous panel. This is where you can get your trusted information from. And if you have questions, again, I'm just going to remind you, those go to FNHMA at ihtoday.ca. Dr. Richardson, another question for you. I can't imagine how exhausted all of you are right now. How are you doing?
Thanks so much for asking that, Marian. I think it's just been it's been a long haul for all of us, right? And like some of my colleagues here, I've been doing a lot of work in our communities around getting vaccines out to folks in the urban setting, but also in some of our more remote communities. And I have to say that actually brings me joy, because I get to see the other side as well, which has been treating people with COVID in the hospital. And that is really, really, really hard and really exhausting. And you worry about every patient I see who has this. So what has been for me the biggest source of joy during all of this has been seeing how our communities have come together and have actually been incredibly thoughtful, innovative, done the wraparound care where a vaccine, as I said, is one part of all of the care that we need to be doing, taking vaccines right out to our most vulnerable people. And the uptake that I've seen in the spirit of protecting the collective, protecting one another has been really powerful. And so I think that's what continues to to give me joy. Miigwech.
Oh, Dr. Richardson, I'm going to actually keep you right here. I know that you work in our communities, but you're also serving a large part of our urban cousins who really need to get access to the vaccines. We need to reach our urban cousins. I want to give a huge shout out to the National Association of Friendship Centers for advocating for all of the folks who are in urban settings. I'm just amazed at the partnerships that are coming through, but it's in the spirit of our kinship as always. Dr. Richardson, how are you keeping yourself balanced as an Indigenous primary care provider?
Well, it's been really important to me to stay well through this. I have 2 of my closest family members are actually have advanced cancer, and so they are immunocompromised. So when we look at people who are at high risk of having a bad outcome, I have those people close to me. So I've been really concentrating on how to be well with my own health, so that those around me can be healthy as well, and so that I can continue to do this work. So, I always say those basics that we talk about: mind, body, spirit, emotion, but sleep is medicine. Like, good night's sleep, the physical activity that I need. For me, one of my colleagues just said, "You seem to be out in the bush a lot, or outside a lot." And I said, that's medicine for me. That's healing for me. So taking those moments to take a break and be really clear that I need to step away from this work and have those moments of restoration. I've been working closely with a couple of elders who really support the work that we're doing, and doing ceremony with them has been really important for me through this as well. So I think all those 4 directions, being mindful of caring for myself in those ways, and in so doing, caring for my family and community.
Thank you so much for your dedication, your service, and the commitment that you are showing all of our kinship. It's so appreciated. I am delighted to hear that you're practicing self-care and that you are leaning on your elders, your culture. That is what an Indigenous boss babe does. Had to get that in. Good segue, right? And you too can get one of these mugs from She Native in Saskatoon. I don't get paid to do that. I just thought I'd throw in a little bit of laughter, because that is another tool in our wellness. So Dr. Adams, why don't you come in and bring in our next physician?
Oh, thank you so much, Dr. Richardson, and how refreshing to hear about your self-care. I do think that there is a crisis amongst healthcare workers, and particularly Indigenous healthcare workers and Indigenous caregivers of every kind at every level, in hospitals, but also I think at a community level. And it is so nice to be reminded that we have our own ways of keeping our balance, that we can turn to, because now is the time to be resilient. We're so lucky to now speak to one of my colleagues, literally one of my colleagues, because Dr. Marsha Anderson works for First Nations and Inuit Health Branch, at least a little bit of the time. She has many other titles and other work that she does, including as one of the founders of the National Consortium for Indigenous Medical Education. She has a background in public health. And Marsha, why don't you tell us a little bit about yourself before we get into some further discussion? Because I think people, well, I should have said this earlier on. I think people appreciate learning and hearing on a personal level from, I think, our guests.
Sure. Thanks, Evan. I was just reflecting as we logged on that we have actually known each other, the 4 of us, for in the neighborhood of 20+ years, because we all met when we were medical students around the same time, when we get together twice a year with our Canadian Aboriginal Leaders in Medicine group, at that time, as we were called, kind of the bridge between Native physicians and Indigenous physicians, and teach ourselves about Indigenous health, support our own leadership development, debrief, laugh, dance. And, especially as Lisa was talking about her self-care, just want to point out that how important those peer connections are, not just in medical school, but still throughout our journeys. I've been working on the consortium, obviously, with Evan and Lisa, but I also got to spend time with Danielle in Victoria this summer when I was out there with my daughter. My daughter, Mila, is roughly the same age as one of Danielle's older daughters. We got to meet her new puppy, and that connection, particularly amongst Indigenous dogs, when we've known each other that long, go through things together that long, is part of what's been so important to be able to keep going throughout the COVID pandemic. So A bit about me, I studied here in Manitoba for medical school. I do practice both internal medicine and public health. I grew up right in Winnipeg, so I'm one of those urban cousins. My family roots are in Peguis and in Norway House. In addition to, or outside of medicine, I am a single mom, 2 daughters, Mila and McKenna, who are almost 11 and 7. And I'm feeling a little bit stressed out today because I did order costumes that were supposed to get delivered on time for Halloween, and just checked, and they're not going to get delivered, and their Halloween parties are tomorrow. So we will be making a run to the Halloween store after work, which they will love, but that's kind of life, right? And I have to say, with that news that the first FDA panel approved or recommended approving the Pfizer vaccine for 5 to 11-year-olds, it will make me feel so much better when they can get vaccinated too. I took my littler one to a Jets game on the weekend, and we felt cautious about that, knowing everyone 12 and over was vaccinated, but it was our first time in a real big crowd, and she's not old enough to be vaccinated yet, right? Or if we're going to the store, right now things are pretty good in Winnipeg. We don't have a high caseload in Winnipeg. Test positivity is kind of low, but they haven't really been in stores much at all for over a year and a half. And I just really look forward, as vaccine coverage grows, as more of our population is eligible, like the 5 to 11-year-olds, that we can start to embrace life fully again and not feel like we have to hold back on the things we would like to do, like get away for spring break, travel, because of vaccination status and COVID fears. I also have 2 dogs. One of the best things about the kids going back to school is I can be in my office more. And so I'm not interrupted on panels like this by my inevitably barking dogs. I did get a COVID puppy to add into the family, like many others did as well. It seemed like a great idea at the time. So that might be a little too much personal information. No, Marion likes it at least. What I wanted to just talk a little bit about with the vaccines, and then maybe we can get back into questions, is I know there's a lot of divisiveness and polarizing between people who are vaccinated and people who are not yet vaccinated. And one of the things that I've been doing is trying to make myself available to have conversations, sometimes with groups of people or one-on-one with people who aren't vaccinated yet. And part of how I approach those conversations, few things. One, this one little line I heard one time, which is that rational people can disagree. It's very helpful to remember that sometimes. And from a place of respect and autonomy, to assume that the reasons the person has not been vaccinated yet are valid to them. And so I should also be treating them as valid and entering into a dialogue, right? And I think that's a pretty important part about meeting people where they are at too. That doesn't just mean, a mobile vaccine clinic to an inner city neighborhood, although that's often part of making vaccine accessible as well. It's meeting them where they're at with their current level of information, understandings, fears, hesitations, and assume that they are actually in the position where they are making the best decision for themselves at that time as they weigh it. Like, that has to be our starting point for conversations. And I think it's important to mention that because more of the conversations that I've had with people have been people who haven't made the decision yet, who are in this kind of gray area, really afraid of a number of different things, and aren't trying to cause problems for the population or more strain on the healthcare system. And granted, there are people who are just never going to get the vaccine, who have different value sets around individual liberty, who weigh different sources of information differently. Those are not the people I've been predominantly having conversations with. But I also don't think we should be assuming everyone who hasn't been vaccinated yet belongs to that camp, right? So last week, for example, I had a conversation with a small group of people, employees of an organization, struggling with the decision. was an open conversation. And what struck me during that conversation was the number of times someone cried, like how heavy this decision was weighing on them, because of, conflict it's causing with the families. One person talked about how when her friends call her to go out now, she has to make an excuse because she can't get in anywhere in Manitoba because she doesn't have, she's not fully vaccinated, doesn't have proof of vaccination. So it's isolation in a different way as well. That's also being layered on by stigma. So especially as a healthcare provider, I want to be approaching these conversations in a way that is respectful and is not kind of layering on to that stigma. When I'm talking to people, some of the things that I'm hearing, one is some concerns, for example, in younger people around fertility. And I think it's important to note that there actually hasn't been any evidence at all of impacts of the COVID-19 vaccine on fertility. And as my colleague, Dr. Richardson mentioned, this vaccine's been given almost 7 billion times now, actually worldwide, 6.96 billion doses worldwide. It's a lot of people over enough time, right, to observe some of these rare side effects or unanticipated impacts. I think it's also important to know that there isn't a relationship between really any vaccine and fertility impacts that we're aware of. There are some suggestions that for people who are maybe considering IVF or other fertility treatments, that they might want to space their vaccine and an IVF cycle because of the heightened immune response from the body, but not considered to impact fertility over the long term in any ways, and not really a plausible mechanism by which that would happen. And one thing that I like to point or like to use when I'm talking with people is consider the theoretical risk of side effects or the risk of actual side effects to the risk of that happening with COVID-19 infection. So earlier on, one of the very, very rare but serious side effects that was identified was the blood clots, right? And maybe people weren't aware that that was a very, very rare serious side effect to the vaccine, but it's actually a common complication of COVID-19 and severe outcomes, right? So you're much more likely to get a blood clot related to COVID-19 infection than you are from a COVID-19 vaccination. And the same could be said actually of the heart inflammation in younger people after second doses, right? Sure, it's possible after COVID-19 vaccine, but it's also possible and much more likely if you have COVID-19 infection. And so I think it's important that we reassure people that the COVID-19 vaccine, first of all, even though breakthrough infections do happen, people who are fully vaccinated are still 10 times less likely to get COVID at all, and almost 40 times less likely to have a severe outcome. But if you make the choice to get the very safe and effective protective vaccine, your risk of a side effect, one of those rare but serious side effects, is much, much, much lower than the benefit you've gotten in reducing that risk of a severe outcome, which includes things like blood clots and heart inflammation. So, we always often in medicine or in public health talk about the risk of doing something and also the risk of not doing something. And so the risk of remaining unprotected against COVID certainly still at this time far outweighs the risk of side effects from the COVID-19 vaccine, even when we're talking about the most serious side effects. The other thing that I just wanted to highlight, and thinking about how we're seeing this pretty common pattern of lower coverage in younger populations who are eligible, the 12 to 19-year-olds, the 20 to 29-year-olds. Like earlier on, we might have talked about how the vaccine is most important for you. So you are protecting the children in your life, protecting the elders in your life, with the elders being more at risk of severe illness. It is important to note that the patterns have shifted with Delta, and we are seeing more severe outcomes in younger populations as well. Right now in Manitoba, there are 27 First Nations people in hospital, and the youngest person is 13. And of the First Nations people in the ICU right now, the youngest First Nations person is 19. Like there is a smaller but still real risk of severe outcomes when you're younger. And we've seen that risk seem to go up with the Delta variant. So I just want to really encourage people to continue to consider the risk of doing something to protect yourself, in this case, getting COVID-19 vaccines, with the risks of not doing that, which is a higher risk of COVID, higher risk of a severe outcome, even in younger populations. So I think I'm going to stop there.
Thank you, Dr. Anderson. And Marion, do we want to throw in a couple of questions before we do the Q&A at the end? How are you feeling?
Absolutely.
I want to ask.
Absolutely. So many burning questions for you. I would like to share right off the hop that I made a little omission of at the front end of this is, my goodness, if you did not get in on this viewing right now, don't worry. We have a lot of rebroadcast partners coming up. I'll share that at the end of the show. But we are being played on 150 Indigenous radio stations across Turtle Island. We are also live on the APTN Facebook page as well. So no pressure, docs, but we've got some eyes on us, which is great because it means all of our partners are coming together from a media perspective as well to ensure our voices are amplified and that people are going to hear these messages. So Dr. Anderson, first of all, I'm not going to hold it against you that you're in Winnipeg and I am a Saskatchewan Rough Rider girl from Treaty 4 territory, Saskatchewan. Go Riders go. Just had to say that because, you know, a little bit of a rivalry going on between our football players. But all kidding aside, Dr. Anderson, do you want to share a little bit with us about how your work is going with Nations? I know you were on your way up to a community and we got lucky that you weren't able to make it. Like, from a media perspective, we're so happy you're with us. How is it going with community leadership, and how is that happening in community to set up protections and take care of outbreaks that we're seeing? Tell us a little bit about that, if you don't mind, Dr. Anderson.
Sure, will do. I'll just say I'm pretty sure that the Bombers are in first place in their division right now and are like undefeated over 8 games or something like that. Pretty sure that that's the situation.
Oh, that salt hurts.
So, you know, overall, I am incredibly proud of how the First Nations vaccine rollout has gone here in Manitoba. And I'm just so impressed by the collaborative approach between Manitoba First Nations, Ongamazin, federal government, provincial government, and how that has rolled out. You know, right now on reserve, coverage with at least 1 dose is over 95% in Manitoba, with 10.5% needing their 2nd dose still. Like, it is remarkable. We've given over 205,000 doses of COVID-19 to First Nations people in Manitoba. Off reserve, it has lagged somewhat, but we finally hit over 70% with at least 1 dose, with about 5% needing their 2nd dose. And the work of urban Indigenous organizations since they started their clinics, and, you know, working in collaboration again with other service delivery organizations, Aboriginal Health and Wellness Clinic, FIT teams from the province and the Winnipeg Regional Health Authority, have seen steady and significant increases in that off-reserve coverage as well. It is making a difference. So what I'm noticing as a public health physician with FNIB is when we have outbreaks starting in communities that have higher vaccine coverage, they are much easier to bring under control faster. And so we've had to have fewer communities under public health orders or in lockdown in response to cases. And even though our numbers have risen, we are still at this point, and, you know, fingers crossed, even though our case numbers have risen, we're still not seeing the type of hospitalizations that we saw in wave 2 and wave 3, where often First Nations people made up 50 to 60% of the people in hospital at any given time. And so that's very reassuring. I can't remember, might have been Evan, might have been Lisa, who talked about the younger age structure. Like we just have more susceptible people in community because of that younger age structure, which does mean it's still going to spread, you know, when we think about overcrowded housing and multi-generational homes, for example. But I'm very encouraged by what I'm seeing. You know, we have some tough situations, but overall, you know, it's great to compare what we're having right now in our fourth wave with really the devastation of the third wave. And the one thing that's different is our vaccine coverage.
You said that like a champ. Thank you so much. I'm just going to give a cue to the studio that we're going to be ready to play a video in a moment. So I'll let Chris cue that up. Dr. Anderson, you talked about stigma, and we know that stigma has been a driving force in some of the reluctance, some mistrust going on, and it's our responsibility to share with all of our kinship that we have to remember our values in and being grounded in those Indigenous guiding factors of trust, of compassion, of culture. And I do want to share a quick video with you all. It's a minute, but this comes from our partners at the First Peoples Wellness Circle, the Thunderbird Partnership Foundation, and our health directors on COVID and the stigma that's happening. So a reminder of our guiding cultures. I'm going to throw it to the studio to welcome a Soar Above Stigma campaign, and we'll hear from Serenity.
There's lots of bullying at the school that I come from. I ended up in a neck brace. I had a concussion. I got kneed in the back of the head. Sometimes things can get really bad and you think, oh, like there's no point of like being here. The support from people around you has a lot to do with the anxiety and depression. Because I'm different, a lot of people didn't understand. Through acceptance, we find belonging.
Thank you so much, Thunderbird Partnership Foundation, First Peoples Wellness Circle, Dr. Brenda Restuhl, Dr. Carol Hopkins. We really appreciate you reminding us, and we'll have a couple more reminders about our compassion for one another and playing up to those strengths that we have all had in being resilient throughout mankind. So, Dr. Adams, come on back into the crow's nest and let's bring in another physician.
Yes, Dr. Danielle Bain-Smith. Danielle Bain-Smith is HODene and also, like Dr. Richardson and Dr. Anderson, a longtime colleague. She's the Deputy Provincial Health Officer for British Columbia. And she's done some extraordinary work in BC, and I'm looking forward to hearing your perspective, watching over the 200 or so First Nations that are in that province. And I think BC has had some highs and some lows, and I know that many of us look to see what's happening there with you and Dr. Henry and some of the tripartite work there. I'm quite curious to hear how your interactions with leadership at a provincial level, where you're working, but also with Indigenous leadership, particularly First Nations leaders. Dr. Danielle Bain-Smith.
Oh, Masi Evan, thank you. Good morning, everybody. It's very lovely to be joining you today. I'm calling in from my office at the Ministry of Health on the territories of the Lekwungen peoples of the Songhees and Esquimalt nations, and I'm very grateful to be joining you and to be amongst friends. It is really hard to believe that that it's coming up on 20 years since our friendships began. Yeah, I'm Danielle Bain-Smith. I'm Echo Dene from Fort Nelson First Nation in the northeastern part of what's colonially known as British Columbia. And I'm also French Canadian and Métis from the Red River Valley of Manitoba. And yes, I've been working in this role with the Office of the Provincial Health Officer for a number of years, and have been learning a lot through this pandemic, certainly about different models of government and how do we elevate and reinforce and create space for First Nations, Métis, Inuit self-determination during a pandemic. And so actually, I'm so grateful for all of the words from my colleagues thus far, and I was so interested because I was thinking, right, like COVID-19 and vaccines, and we're probably all going to be saying the same stuff, which I think we are, but saying it in slightly different ways. Marcia was talking about the good medicine of her visit it was in the late summer, early fall, which was like tremendously good medicine. And Marion, when you were asking Lisa, how is she doing? I like wanted to start crying because like we're tired, right? Everybody's tired, everybody's depleted. And it's just been this really long, hard go. And so I'm so grateful to everybody here for the medicine that is you, that is your words, and for everybody that's listening in right now, just acknowledging that this has been a really challenging experience that we've all been going through with this really tricky relative that is COVID-19, right? Like my personal low point came just before Marcia's visit. So I was so grateful because, things were looking pretty good, right? In the summertime, it looked like we might be right at the end of the tunnel. And then this tricky Delta variant just kind of changed the playing field once again. And so when I came back from a holiday to finding that things in BC had kind of done a bit of a U-turn, I was really like demoralized and dispirited and thinking like, oh my gosh, what can we do next? But yeah, there are a number of good medicines out there, the social connection, all of those things. And I think what I really wanted to speak on today, just in my few minutes of remarks, is that these vaccines are really good medicines. Like we think of them and the vaccines have in a way become stigmatized in the use of that language. But right from the outset, I've thought of them as medicines and medicines from the creator. And I've been so grateful. And when I went to get my shots, I sat with the medicine, I prayed, I gave thanks the same way that I do if I'm harvesting medicines out on the land. And so I think that's a piece of this conversation that I just wanted to bring into it too, because I think so much of how we move forward has to do with our perspective and how we see things. And so I think for me anyway, seeing these as medicines has been really helpful. I have members in my family who are choosing, so far have not been vaccinated because they don't trust these medicines, they don't trust the healthcare system, and they don't trust the government. So they were really skeptical, especially at the early start of this these vaccine program rollouts. Like they just flat out said, like, this isn't right. Why are they giving them to us first? That isn't right. In their mind, that was kind of sketchy. It was suspect. And we have really good reasons not to trust the government, right? We live in a nation of Canada, a country that was founded on ideologies of white supremacy, and a government and governments that have undertaken systematic attempts to extinguish us as Indigenous peoples. So absolutely, I totally understand that distrust. And I also believe that in order to honor our ancestors and their sacrifices, in order to hold governments and systems accountable to upholding our Indigenous inherent rights, we need to stay healthy and strong. And so that's why I believe that one of the ultimate acts of resistance and decolonization is to go out and take these medicines that, as my colleagues have already described in great detail, dramatically reduce our risk of being really sick from COVID-19 or even dying from COVID-19. There have been pandemics in the past that have totally decimated our communities. And I've thought about that, and I've thought about those lost lives, those villages, like complete villages that have been wiped out. And again, I believe that by rolling up our sleeves and keeping ourselves and others protected from this deadly virus is a way that we can honor those villages, honor those people, honor the languages that were lost in that history of biological warfare that was thrust upon us. I really do get that some people are scared, like legitimately scared of the vaccines, and I think about so many of us and you know, what we've been through, what our family members have been through, the traumas that we've experienced, and how we're strong and resilient, and how we have nervous systems that are primed to, that are vigilant, right? That are ready to kind of react. And so I think, you know, in a lot of ways, that fear like runs pretty deep. And so I really appreciated Marcia's comments about the way that she's entering into those conversations with people in a very deeply respectful way. And so that's what I certainly have been trying to do as well, as I have those one-on-one conversations and you know, with groups of people or smaller groups of people. And I think one of the things that I also wanted to bring into the conversation, because I think Marcia said it so beautifully about, you know, what is the risk of the vaccine and what is the risk of COVID-19? And I think there's this really important piece that applies to us as First Nations people that doesn't always get included in our risk and our decision-making process, but it is the risk to our cultural continuity. You know, in the beginning, it was pretty clear that this virus and the earlier variants of this virus were hitting elderly people the hardest. Right? Age continues to be the biggest risk factor for dying from COVID-19. And that struck a fear in my heart, because I thought about our elders and our knowledge keepers, the people that hold our ceremonies, our languages, you know, like how critical it is that we keep them safe. And now we're at a different phase in the pandemic. And it's wonderful to know that so many of our elders have gone out and been vaccinated and they have that protection. And now I'm thinking about the younger group. I was about to include myself in that younger group, guys, because I still feel like I'm like that 20-year-old medical student right at the beginning. But thinking about our younger people and like, cultural continuity, it's not good enough for us to protect our elders and knowledge keepers. They need to have those of us sitting at their feet, ready to absorb those teachings. And so I'm completely with Marcia, like I'm right at the front of the queue. My kids are 5 and almost 10. I've got them registered already in our Get Vaccinated BC system, just waiting and anticipating that approval and the arrival of vaccines for kids. And I think, you know, as younger people, we have these really important sacred roles to play in keeping our ways of being, our ways of knowing, our languages, our lands, our ceremonies alive and thriving. And again, for me, that's like the ultimate act of resistance. We are still here and we need to stay here and be healthy and strong, to be able to honor our ancestors and everything that they sacrificed. And as I said earlier, to really hold the mainstream government and systems accountable to their duties. So I really do believe that these medicines are safe. Marcia mentioned that we have close to 7 billion doses of experience globally. Here in Canada, we've administered over 56 million doses that have all been registered. We track and watch for those safety signals so closely. And of all of those over 56 million doses, a very small handful have had serious adverse reactions. And as Lisa mentioned, many of those were allergic reactions that were treated on the spot. In BC, we have experience in our health authorities where people who've had that life-threatening anaphylactic reaction to a first dose have gone on to successfully complete their series of vaccination under, as she mentioned, a controlled setting, supervision with an allergist. So, 0.009% of these doses of vaccines that have been administered have had a serious outcome, but as I just mentioned, most of those treatable, whereas our data here in BC has shown just from the last week, our most recent round of data, that people who are unvaccinated are 40 times more likely to be hospitalized and 41 times more likely to die. And I really feel like those numbers in our communities where we are like doing everything we can to exercise our self-determination and keep all of those things that make us uniquely ourselves, uniquely Dene, Tunaha, Anishinaabe, Cree, Haudenosaunee, like all of those things that make us ourselves. We need to be here to receive those teachings and then to pass them on to our young ones. And so I just, from where I sit and the data that I get to see, we just can't carry the burdens of this particular virus, this particular strain, when at this point in the pandemic, it is preventable because we have these good medicines available to us. So I really am grateful to be joining you today. I'm so grateful for everyone that's listening and so grateful to my colleagues and panelists who have been my good medicine and that have helped carry me through my low points during the pandemic. And I know that we've all had those as well. So Masicho, Marion, and Evan, I'll pass it back to you.
Oh, you are just a pleasure to chat with. Anytime I've ever interacted with you, I remember you coming out to the FNHMA conference a number of years ago, and the lineup of folks to speak to you was through the hallway, out the door, around the corner of the hotel. And that is exactly why. We felt it in our hearts. We really did.
Did you hear that, Evan? Ooh.
Evans, Dr. Adams, you got run for your money.
I'm taking off the crown.
Well, you know what? An Indigenous woman physician. Just saying, you're outnumbered here, Dr. Adams, today.
All women here today. I love this.
I do have a question for you, very specifically, because you are in BC. Let's chat about the excitement. I know I'm excited for one. I'm like holding up my hand, pick me for that third dose. Why is that third dose important? And I believe BC's already started the administration process of that. So share with us a little bit about why it's important to roll up our sleeve again.
Totally. Thank you for that question, Marion. And yes, I think we might be like just a little bit ahead of the curve, but I think other places are quickly following suit. And so I maybe actually, even before I start there, I just want to clarify the difference between a third dose and a booster shot, which is also a third dose. So it's a little bit confusing, but it's got to be about 6 weeks ago now. BC did start rolling out, as many other or all other jurisdictions in Canada rolled out third doses for people who were severely immunocompromised. And that was looking at the Western scientific literature and seeing that certain underlying medical conditions, like having a solid organ transplant, having certain blood-borne cancers, meant that people who had those conditions and received the first 2 doses of the vaccine didn't actually mount the same level of immune response, didn't get the same level of protection as the rest of us. And so when we started to see that emerging in the Western scientific literature, we realized that we needed to start offering third doses to that group, that specific population, to make sure that they had the same level of protection as the rest of everybody. So in that instance, that third dose was actually a completion of their first series. What we're talking about now is a little bit different, this idea of booster doses. And this is a really interesting area that's a little bit complex in the sense that, you know, naturally with most vaccines, the immune protection that you get from that initial vaccine will wane. It will drop off with time. And so we've been following other areas around the world that started their vaccine programs earlier than us to kind of get a sense of when we might expect to see that our protection is starting to drop. We can't compare ourselves exactly to other places, for example, like Israel or the United Kingdom. They gave their vaccines in a shorter interval. So dose 1 happened, and then 3 to 4 weeks later, people were getting dose 2. Here in Canada, we started lengthening that interval between the doses, and that actually appears to be giving us a longer lasting immunity, more protection for a longer period of time. Figuring out when to pull the trigger on booster doses is a bit tricky because you want to make sure that you're not wasting any of that good protection that you got from those first 2 doses, but you also don't want to go too late where you're starting to see a fair number of breakthrough cases. So that's where in BC and in conversations with the National Advisory Committee on Immunization, we've been watching the literature, we're watching what's happening here in BC, we're watching what's happening in other provinces and territories as well. And we're feeling like probably this is about the time to start talking about, you know, how are we going to maintain that high level of immune protection. I will also say that this is a bit of a, well, not even a bit of, it is a controversial area because this is about equity. And as we're talking today, we know that there are people in our own families, our own communities who haven't been vaccinated yet. And as Marcia really clarified, for some, you know, it's not all one reason or one rationale. So we also want to continue our efforts to make sure that people have the best available, accurate information to make their decisions about being vaccinated before we're going to top up everybody else's protection as well, right? So there's like so many different factors, and this is a global pandemic. So we need to make sure that vaccines are being distributed equitably around the world as well, because that's the only way out of this pandemic is to move forward together. So thanks for the question, Marian, and I'll pass it back to you.
Well, thank you so much. I'm just in awe of the collective wisdom and how fortunate all of the listeners and viewers are to have this firsthand opportunity to ask a physician, to ask a care provider, to ask those questions that you might be a little shy to ask elsewhere. And don't worry, if you have a question that you want some anonymity around, send it in to fnhma@ihtoday.ca, because now is your opportunity to actually, dig in and ask those questions that we're afraid to ask elsewhere. So on that note, I am actually going to point out a question to our two amazing, not just physicians, but moms, right? We've got two moms here, and I am going there with your mom heart now, because we don't compartmentalize who we are. We're whole in all of that. But we know that there may be some parents who are going to be protective of their children and worry about some of the safety around vaccinating young people, children. Does that need to be taken into consideration when we are planning our vaccine clinics for kids? What does that look like for both of you as moms? Are you having those dialogues with dads? And tell us about how you're feeling, and are your kids getting vaccinated if they can? Who wants to take it? Dr. Anderson, Dr. Bain, which one? Come into the crow's nest.
I can start, and then Danielle maybe has a few comments to add. My kids are excited to get vaccinated. They want this. They ask regularly when it's going to be approved for them and when it will be their turn. And I'll just note, they're afraid of needles. So for them to be like eager to receive a needle is unusual, but they actually understand how important this is for all of us and for the things they want to do, and being able to safely gather with grandparents and other family members as well. Their Dakota family lives across the border in South Dakota. So for us, all being vaccinated is key to travel, so they can reconnect with family down there in a more safe way as well, because our cousins south of the border have also been very hard hit by COVID-19 and the variants. So that's really motivating for them. And I really want to be able to take them down to Sundance next summer. It's been hard to miss it for the last 2 years. So those are all reasons why they're excited. Now, why am I so happy for us to move forward with this? I think overall, childhood vaccines are incredibly safe. We give a lot of vaccines to our kids starting at age 2 months and then right through, the teenage years to our ongoing adult vaccinations. They are incredibly safe. And I have no reason to think that the safety of the COVID-19 vaccine will be any different for them. The data is being submitted, it's being reviewed by experts. When it's published, I will certainly read it myself as well. But where I stand as both a mom and a physician, and wrapping all of that together, is that I trust this vaccine for my kids too. And so yes, they will be happy to go as soon as we can get that set up. One of the things we will talk about, because one is 7, one will probably be 11 when the vaccine starts rolling out. She turns 11 in November, is where they want to be vaccinated. So different communities, different jurisdictions taking different approaches, considering potentially school-based clinics without parents there, or pediatricians or doctors' offices or other vaccine clinic approaches. And so part of the conversation that I will have with them is, where are you going to feel most comfortable getting your vaccine, and then giving them that choice, and we will figure out a way to make it work.
Spoken like a loving mom. Thank you so much. Danielle, come on in and share your thoughts.
Thanks, Marian. Yeah, my kids are very much in the exact same position as Marcia. So they've been wanting to get the vaccine from day one. Actually, my 5-year-old turned 5 in the summer, and so she had went and got her 5-year-old vaccinations. And so she was very proud of herself, because she did get a lot of pokes, and she was telling everybody that she got vaccinated, and her older sister would be quick to interject. She go, "Not the COVID vaccine." like, you know, sibling rivalry is alive and well. So they'll be, yeah, they're going to be absolutely thrilled when they can get the vaccine for the exact same reasons that Marcia has just described. My family, our territory is in the northeastern part of the province, and that's an area with much lower vaccination rates than other areas in BC. There's been a lot of COVID-19 cases there, and so we haven't been able to travel there because, again, in my weighing of the risks and benefits, that risk of traveling there with unvaccinated kids has just been too high. So my daughter Lucy is fully expecting that with her COVID-19 vaccination will be a plane ticket for 7 days later to get her butt up and to visit with her family in Fort Nelson. And I think for me, like, I get that. Of course, as parents, we want to do right by our kids. Like, we want to make the best choice. And as Marcia mentioned earlier, people, it is a big decision for people. And people are flooded with so much information and so much misinformation. And so depending on where people are spending their time, who's in their circle, what's kind of coming through their social media feed, they might be getting very alarming messages that are making them unsure about what is the best thing for me to do as a parent, what is the best decision for me to make for my kids. And that's where I totally agree with Marcia. From where I sit as a First Nations Métis physician, spending decades of my life in this biomedical world and looking at this and looking at the science of vaccines, looking at the Western science of these particular vaccines and the Delta virus and the way that it's hitting communities hard, it is like so clear to me that what is best for children at this point in the pandemic is to be able to access these good medicines. So it's really clear to me. And that said, I'm with Marcia that I know that's a really big decision for people. And so really do want to make myself available to people if they have questions specifically about kids and vaccines, because you want to be able to feel really confident making that decision.
That is a spectacular note, is being available like everyone is today here on this panel. And it's not too late. We're moving over to the inbox in a moment. It's not too late to get those questions in to fnhma@ihtoday.ca. Now, I do want to just cue the studio. Let's continue to hear some of those messagings around stigma and reducing the stigma of COVID-19 and expressing our beautiful values of acceptance as well, and checking in on one another. And if you have a story that you want to share, use the hashtag #SoarAboveStigma. And maybe it was just something as simple as a neighbor bringing over some groceries while you were self-isolating. Keep soaring with us. And with that, Chris in the studio, let's welcome in the video from Soar Above Stigma, and let's go to Audrey in our video little intermission.
I used to feel such shame. It was hard being surrounded by women who trauma and abuse left cruel streaks, violent behaviors, and disconnected ways of loving. And now I'm freeing myself from that shame. This is where our societies, our circles, our connection to the land comes in. Learn to be kind to yourself and to others.
Isn't it nice to have those reminders from our cousins, our relatives, of reminding us the importance of our culture and our values in everything that we do? And this is no different. So before I go over to that inbox, Dr. Adams, come on into the crow's nest. I do have a question for you, even though you're moderating today, but I know you're going to have the answer to this because I've asked you before. Tell us again why we have been prioritized, because I know a lot of folks are saying, and that goes with that mistrust that we were talking about a couple of moments ago, is why is the government prioritizing us on this vaccine? We've never been prioritized before. And are they inserting those microchips into us? And like, you know, I'll give you a box of, no, I won't go there. I won't go there. Dr. Adams, come on in, rescue me from being a stigma person and tell us why we were prioritized.
Yes, we were prioritized quite early on. We were identified as having a very special risk. And initially, the first thought was, well, remote Indigenous peoples have special risk because if they get COVID, they have very little medical support around them in remote areas. And so those remote Indigenous people should be at the top of the list. But very quickly, we realized that, you know, there are many barriers to Indigenous people's care. This is very well documented. And there are certain what we call socioeconomic risks that things like overcrowding, things like housing, things like the availability of isolation spaces, even things like clean running water to wash your hands and have good COVID hygiene, or the ability to throw open windows and doors so that you have good air circulation, could be a challenge for some peoples. And of course, always, the burden of illness on Indigenous people is quite heavy. In fact, we, and this is a generalization, but we have the worst health of any ethnic group in the country, in our own lands. So unfortunately, too many of our people have less than amazing health, especially compared to other Canadians. And so it was an evidence-based choice, not a political choice, that Indigenous people need special support and they should have access quicker than, you know, others who are generally well. So yeah, so that was the rationale. I'm not sure if Dr. Anderson or Dr. Bain-Smith want to comment or add in.
I think you covered my understanding of that as well, Evan. And I would also, you know, just bring into the fore that that at least in BC, First Nations Health Authority and First Nations leadership were at the table. Métis Nation BC was also, you know, a party to and advocating. So, you know, our leadership, our community leaders were saying, you need to prioritize us to uphold your accountabilities to reconciliation and to fulfill your treaty rights. We are not going to be last in line. So I just wanted to bring that as well, because I saw that happen very clearly here in BC, and I believe other places as well. That this isn't something that was done to us. This is something that we were directing and guiding.
Yes, and I hope we'll get to talk about partnerships.
Yes, absolutely. What are your thoughts, Dr. Anderson? I know that, I mean, we sure as heck called out the province of Manitoba a number of times on the COVID-19 town halls for not having included Métis people at the tables as well. Tell us your thoughts on this.
Yeah, I'm not going to comment on that. There's a lot of backstory there, and I think that's a really bilateral conversation to have between Manitoba government and the Manitoba Métis Federation. So out of respect for our Métis relatives, would want to defer that there. But I really would celebrate the strengths of our First Nations collaborative relationships and First Nations leadership in our pandemic response. And absolutely, we still experienced more COVID than we should have, because our response was within the context of really unequal risk conditions to start with. And if there's one takeaway I would have, it's still going to be the takeaway that I had after H1N1 as well, which is if we're not going to fix housing and reduce the impacts of overcrowded, inadequate housing, we're going to be in the same position in a decade, because we never fix structural problems with program solutions. And it's true for the vaccine as well. It's a great intervention. And we needed to, for us, equitable access meant early access to try to mitigate that increased risk because of those unequal conditions. But it doesn't remove our collective responsibility to address those unequal conditions in the first place. So one of the partnerships I'll celebrate a lot is the partnership between First Nations Health and Social Secretariat of Manitoba, who has a long history in First Nations-led research, with Manitoba Health, with the information sharing agreement, because we have had really excellent First Nation specific data that actually also includes our non-status relatives and both on and off reserve. And that has been the backbone of our public health response, having that excellent data to bring forward evidence-based decisions, including early vaccine prioritization. And we saw very clearly the impacts of that, not just early prioritization on reserve, but applying the 20-year differential. So when they started the age-based general population rollout, First Nations people were eligible at younger ages, responding to what we saw in the data around having severe outcomes at younger ages too. And then being able to work with First Nations organizations across the province in ways that really respected autonomy and self-determination. So we had our provincial level pandemic response coordination team. We worked also with the Northern Chiefs and Southern Chiefs organizations. And then with our rapid response teams, worked collaboratively with partner organizations, including the tribal councils, and always in support of community leadership, who was implementing community level measures, who really took the lead on making decisions and promoting vaccine at the community-based clinics, whether that was sites or transportation needs or use of incentives. And so it really was more around how do we all work together, respect where different decisions need to happen. And it's one of the things that I really hope we can carry forward into other aspects of the health system too.
Thank you so much, Dr. Anderson. I really appreciate you unpacking that. I'm going to take a dive into the inbox now. If you guys are ready, we do have some technical questions for you, and I'm just going to put it out there and feel free to jump in with the responses. So one person is asking, they've had one dose of Pfizer so far, and they are on antivirals for HIV. Do they need a second dose of COVID-19 vaccine? I see nodding, like that was immediate.
Yes.
That cut and dry, yes.
Yes, and I would add absolutely. So completing that first series of the vaccine is critical. And here in BC, we are offering third doses to kind of get that full immune protection to some individuals living with HIV. And there's a whole list of medications that are included in that. So depending on where this individual is living, they may also want to check out the BC CDC website that lists those who are eligible for a third dose, but absolutely get the second dose. That sounds great.
Excellent answer. Thank you so much. That was an easy one. I'm going to jump into some more questions. You guys up for it? All right, let's do this. Okay, so a question in here is, if you have already been infected, I should have put my glasses on. If you have already been infected by COVID, do you still need to be vaccinated? I think I know the response.
Yeah, it's a great question, Marian. I can go first and then my colleagues can chime in. So when somebody has been infected with COVID-19, they do develop some natural immunity, but we don't know how strong that protection is or how long it lasts. So we have these unknowns. We have really good studies showing that people who've been infected with COVID-19 who go on to complete the series of vaccination have a very, very good immune response. Like they get really, really good protection from that. So our recommendation is absolutely, even for people who've had COVID-19, that they go on to get that full protection from a series of vaccination.
Thank you, Dr. Anderson.
Yeah, one piece that I will just add to that is you also don't have to wait. There's no set time period after when you've had COVID-19 that you have to wait to start your vaccine series. Or if you get infected between your first and second dose, once you are recovered from your infection, you're out of isolation, you can go ahead and either start or finish your series.
I love this. We are getting questions answered. Ask an Indigenous physician at fnhma@ihtoday.ca. Can you believe I've never been a broadcaster before? Like, this is off the side of our desks. Luckily, we have Dr. Adams here as well, but I'm having so much fun doing this. We need to smile. We need humor. We need each other to get through these without certain times. It's just been exhausting. So let's just keep having a little bit of fun for the 32 minutes that we have left in our conversation. Let's chat and unpack herd immunity. We heard so much about this at the beginning of this pandemic. Where is that at now? Are we achieving it? Do we need to achieve it? What can you tell us about herd immunity?
You know, it's really interesting because discussions of herd immunity have really fallen off. And I think in part it was because it's a constantly moving bar, you know? And so I remember early on, we talked about 70%. I actually did a little video with McKenna trying to explain the concept of herd immunity. Really what it is you have enough people who are immune to the infection that you break up transmission chains. So you might see sporadic cases or a little cluster somewhere, but you don't see widespread transmission. And then how you calculate how many people you need to have immunized to achieve this so-called herd immunity really depends on how transmissible the virus is, how it spreads and how easily it spreads from person to person. And so, you know, the initial herd immunity calculations were kind of built on that original COVID-19 wild type, sometimes it's called, I like to call it the OG. But then we had the alpha variant, right? Which was roughly twice as transmissible as the OG. And now we have the Delta variant, which is like twice as transmissible as the alpha variant. And so it was this kind of constantly moving bar. But the other thing is, sometimes when we think about herd immunity, we imagine that the 80% or 90% of people are evenly and randomly spread throughout the population. And so that there's like equal protection to everybody from everyone else who is immunized. And that's not really how things work, okay? Because we have age groups who still aren't eligible for the vaccine. And then we see concentrations of people who are not vaccinated in certain parts of cities, in certain parts of provinces or regional health authorities, or in certain First Nation communities. And the thing is, those networks are more likely to connect with each other than they are to evenly mix throughout the population, you know? So they're more likely to be in contact with other unvaccinated people as opposed to being in contact with 8 out of 10 or 9 out of 10 adults who are fully vaccinated. And when they're more in contact with each other, what we just have is a group of susceptible people that COVID can still spread in. And so that's why we just really started focusing on, really, we need everyone to get vaccinated, like as much as possible, as high as possible. I don't even know that there's like a specific target anymore, because what we know is as long as we have pockets, however big those pockets are, of unvaccinated people, we will continue to see COVID spread there. So yeah, I think that's why we're not hearing as much about herd immunity anymore.
I wonder, Marion, if I could just add something as well, that it's not really necessarily specifically talking about herd immunity, or in BC, we talk a lot about community immunity, essentially the same thing, different names. But, you know, I do think back to our overarching pandemic goals, which actually haven't shifted, you know. So from the outset, we've wanted to minimize serious COVID-19 in people who are vulnerable. So primarily that, again, is age-based. So really looking out for people in older age groups. Our second goal was to keep our healthcare system functioning and like ready and able to serve anybody that needs hospital acute healthcare. And the third goal, to minimize the disruption to society and minimize all of the unintended impacts of those restrictive public health measures that we've all come to know. And so when I think about herd immunity, community immunity, vaccination, I'm really thinking about those three goals and like, how can we get across that finish line of this pandemic, because we're all so tired, and vaccines are definitely the tool. And as we get our coverage rates up, that's the tool that helps take the pressure off of particularly our healthcare system strain. We've got pretty good protection for, you know, the very frail elderly. Most have been vaccinated, but it is this strain on our healthcare system right now with younger people in the ICUs that's, you know, that's still driving a lot of those pandemic response measures that we see right now that are in place that everybody's so tired of. And I just also kind of want to stop and mention, you know, that the pandemic measures have taken such a toll on young adults in terms of mental health and social isolation, which we've talked about a little bit. In BC, we did a big survey. We did it twice, so once after the first wave and again just recently this summer. And, you know, mental health has been worsening across the board, but for sure is really impacting young adults, youth and young adults up to 29. And so I know that I'm kind of like off on a tangent right now, but I think it does come back to, is there a set number that we need to reach? Nobody really knows, because we're going to know when we get there. We're going to know when hospital rates start coming down. We're not going to get to a place of zero COVID. So I think we also need to recognize that COVID is still going to circulate and we're going to learn to live with it. But the way for all of us to kind of get to that other side of this, where COVID isn't consuming all of affecting all these different aspects of our life, is to get enough people vaccinated. We thought we had a number, as Marcia described earlier on, but COVID is tricky. And so we just need to keep pushing and keep moving forward in a good way. So apologies for going on a bit of a circuitous route, but there's just all these important things that I think about every day, and think about all these young adults who, you know, it's who I'm no longer a part of. That pining, you know, but that it's been a hard time. It's been a hard time for sure.
Oh, we all feel that, definitely. I think as we get older, the better we were, right? That's kind of the mentality. The older I get, the better I was. But we're all still young and lovely here. All right, I'm going to jump back into that inbox, and I really appreciate everyone who's been putting questions in. A number of them were answered already in our Indigenous Physicians Dialogue. So I'm very excited that we've had an opportunity to share so much knowledge. So I'm going to take another quick peek here. And we do have a question with respect to long haulers. So the question here is, can you please inform us on how COVID-19 affects the cardiovascular system and the long haulers. Reasons for getting the jab, in brackets, maybe go into the complication of being infected. Do we understand the question there? So just unpacking a little bit about what that long haulers is. I see you both nodding. Who wants to take that? Even Dr. Adams, anyone, come on into the crow's nest.
I'm thinking of the arguments around natural infection. Some people saying, well, let's do nothing and let others, let everyone get infected. And one of the reasons we wouldn't do that is because there is a high mortality rate from COVID, but also this injury from COVID, long COVID. And so we are seeing that some people post-infection have these lasting effects, and they can be quite debilitating. I'm not sure, Marcia, if you're seeing that on the ward, or Dr. Bain-Smith, I'm not sure if you're getting data in your provincial office on that, but definitely we're hearing more and studying more about what some of the long-term effects might be from infection.
Yeah, we don't have data on First Nations people in Manitoba with long COVID symptoms. Our data sets don't capture that, but I do see patients every week too, including sometimes patients who've had COVID, and I do hear from people with long COVID symptoms. A really common one is persistent fatigue. And people off work for prolonged periods of times because they just get so tired during the day. And so needing, for example, graduated return to work plans because of the fatigue. Another common one that I hear can be persistent shortness of breath or some chest discomfort. Not too surprising when we think about the lung damage that can come from COVID. One that kind of reminds me a bit of pregnancy and breastfeeding, brain fog. I've heard people refer to it as just not being able to form memories or just feeling like not quite right. So sometimes described as brain fog. But people also can have long-term organ damage, for example, if they have severe COVID as well. And so sometimes the damage to the heart, or if someone does have a stroke or gets damage to the kidneys while in hospital, sometimes those also can be permanent or can be long-lasting as well. So of course, those are all reasons why we would want to consider the vaccine. Again, most of the side effects from the vaccine, the common ones, are all very short-lived and mild. So yeah, I'll stop there.
Yeah, and I would maybe just add, also in BC, we don't have a way to link that data yet. So we don't have specific data on First Nations or Métis peoples, and those would be under the stewardship of First Nations Health Authority and Métis Nation BC if that data comes available. But I mean, it is significant. We have a dedicated COVID-19 long haul rehab unit in BC. People are suffering, and I just know from my clinical practice, which I began my career in family practice, family medicine, and then about about 10 years ago, I shifted my focus into functional medicine, which is a more roots caused based approach to clinical evaluation and assessment and therapeutics. And so I can just tell you that some viruses in some people can just really trigger a cascade of, a ton of different symptoms that can be debilitating. And so in my practice, that is quite focused on people with, a wide range of symptoms. I see a lot of that where people have a viral illness and then they are just never the same again. And so I have no reason to suspect that COVID-19 would be any different. And we're seeing that in the literature. And so it keeps bringing us back to this idea of that this isn't a net neutral. It's not as though if you choose to not be vaccinated that your risks are now zero. You continue to have these COVID-19 risks that we know now for people who are unvaccinated with this current strain are significant. And this COVID-19 long haul does, as Marcia mentioned, it kind of can present across any of the body's systems. And so it's yet another good reason, I think, to go and get the jab that the person mentions, because we know that for 99.999% of people, that jab is going to lead to maybe a sore arm, maybe feeling a little bit achy for a day or two, but then going back to life as normal. Whereas with COVID-19, it's throwing the dice, right?
Thank you so much for answering that question. We have a number of more questions. People were listening in the last shout out with the email address. So I feel like I'm direct firing all of these rapid questions at you, but let's just keep going, shall we? I've just got my second burst of energy. So let's go. Is it true that COVID-19 vaccines must be stored at extremely low temperatures because of the preservatives in the vaccine? Anybody want to take that one? Jump on in, and you might as well just unmute and let's have a conversation about that.
So for long term, the mRNA vaccines, so Pfizer and Moderna, do need to be stored at ultra low temperatures. It has to do actually with the lipid layer that the mRNA, which is the messenger RNA that teaches your body how to recognize COVID, is built in. So they're in these tiny little lipid bubbles. So that's why it has to be stored at ultra low temperatures. You know, one of the interesting things is as we've gone along, even how long it can be taken out of the freezer for and used once it thaws has changed too. So we continue to learn, we continue to adapt. One of the great things about that is it has made it easier to send Pfizer out to First Nation communities, even remote First Nation communities, which was incredibly important for our 12 to 17-year-old campaign, and will also be important for our 5 to 11-year-old vaccine campaign.
Spectacular. Feel free to jump in, others, when you want. Otherwise, I'm just moving on to the next question. So here's another one. I feel like the COVID-19 vaccines don't work because you can still get COVID after vaccinations. Is this true?
I love this question. I totally love this question. So, they do absolutely work, and we have the data, we have the graphs that show before the vaccines, and then when a lot of folks got vaccinated, the COVID-19 cases, dropped dramatically, and the number of cases and hospitalizations we're seeing now are predominantly, 90% plus in people who are unvaccinated. So we know the vaccines work. And I would also say to the person who wrote this question, we also know that they're not 100% effective. So, we have some great research that was just published out of BC that correlated with research out of Quebec that showed that in the community, any of the vaccines that are available give really excellent protection against getting COVID, but it's not 100%. So it's kind of in the 90 to 92% range. So that means if 100 people all get vaccinated, then anywhere from 8 to 10 people could still go on and get the infection. What I would say, though, the real benefit of these vaccines, and this is something that Lisa mentioned in her opening remarks, is that they protect exceptionally well against hospitalization and death. So our research here in BC that tracks with the surveillance data from other provinces is that people who are fully vaccinated have excellent protection against hospitalization in the rate of 98 to 99% protection. Like, that's how effective these vaccines are at keeping you out of the hospital. So a great question that when you peel back the layers a little bit, you can make some understanding of how it is that some people do go on to get COVID after the vaccine, but it's typically a pretty mild illness that they have.
Oh, I really appreciate you answering it from BC, because we know our good friend, Dr. Shannon McDonald, had this experience and shared it with us all, and was so grateful that she had been immunized, because her case was very, very mild in terms of those symptoms from what she shared with us here at FNHMA. So I'm going to go to another question. I see that clock ticking down very quickly. Okay. Here's one for you. This is a comment, but react to it. I have a very strong immune system. I'll be fine against the illness and be able to handle this illness without issue. What do you say to this person?
You know, I'll come back to something Danielle said before, which is this something you really want to roll the dice on? You know, do you really want to take the chance of a severe outcome when we know those severe outcomes are 40 times more likely in those who are unvaccinated, with the discussion we just had around long haul COVID? But also, I'll just know everybody who has COVID passes it on to at least one other person. That's why it continues to spread, right? Like, it's very rare that you were in contact with people who gave you COVID, but you didn't pass it on to anybody else. And in First Nations communities here in Manitoba, what we have seen, particularly in the third wave, was that in household groups, when there was one case, almost everybody became a case, approached 100% of close contacts becoming cases. So does everyone you're in contact with have the same robust, strong immune system that you have for yourself, which might actually be true? But can you say that for everyone else around you also? Because this is really something where we're all in it together because of how easily this virus spreads. So we certainly have to take into account our own risk of a severe outcome, including long haul COVID, as well as the risk of people that were around. And, you know, just want to remind people, you might isolate as soon as you develop symptoms, but you were infectious and potentially spreading it for 2 days before that too. So even if you do the best you can, isolate as soon as you start to feel fatigued and a cough or a sore throat, whatever that might be, you've already exposed people for the previous 2 days. So those are some of the considerations I would have for people who still, or who do feel confident in their immune system, but can still benefit from the vaccine.
Yeah, and I would just add to that. Thank you so much for that, Marcia. And just tapping into something that you said, I think like one of the really wonderful gifts that I think we share in our teachings, and I'm saying this kind of collectively, and I know that we all have our unique, distinct teachings, but I've heard this one in so many different places, is that we really do value our collective above our individuals, right? Like, we have been taught that we take care of one another, not just as humans, we take care of all of our relations, and that we do that for this collective wellness, you know? And so I just want to tap into that too, because that's part of our gift and the wisdom that our elders have passed on to us. And so absolutely what Marcia is saying is that it's not just about the one person who may in fact have a really strong immune response, but again, bringing it back to like today and what we're faced with this Delta variant, we have data that shows absolutely that, you know, most of the spreading and most of the damage of spreading has happened before the person has a symptom or very early on in their illness course, when they may not have even recognized and may not have even self-isolated yet. So this particular variant really has changed the game significantly. So yeah, just thinking about others in addition to ourselves in terms of that protection, and also to just tap into what Marcia was saying, it's different. We are seeing younger people, even with no underlying medical conditions, who have, you know, who we would think would have really robust immune systems, who are getting very, very sick with this virus. We have a 20-year-old who died in northern British Columbia just a couple weeks ago. So yeah, just making sure that all of that today up-to-date information is out there.
I really appreciate that. And Dr. Adams, you just put something in the chat that was absolutely beautiful. It's not about me, it's about we. Powerful, absolutely powerful. When we think about our nokomis, our kookums, our mushums, our unvaccinated children, it is about the collective. I'm going to ask another question here since we're on a roll. And the question, it's more another response for a comment here. This person feels like the COVID-19 vaccine is unsafe because it was developed so quickly. What do you want to touch on with this one? And this is something we've heard routinely throughout the last 20 months. So what are our responses on that? Come on in, Dr. Anderson. Oh, okay, Dr. Bay.
I was going to say, I can jump in. Yeah, it did happen so fast. Like, we've never seen a vaccine that's been developed and approved as quickly as that. And the reason for that is that we hadn't been in this type of unprecedented pandemic before, and there was collaboration like we've never seen. So there was collaboration between countries, there was collaboration between researchers, there was collaboration between multinational companies. So everybody was on board to share knowledge and create vaccines as quickly as possible. And so that's, no steps were skipped. Every single element of that rigorous process that typically takes a really long time, every single one of those steps was carried out in the same way with the same high quality. What made it possible to happen so quickly was the amount of resources that was dedicated to it and the collaboration. And the fact, I would also just mention, you know, Marcia was talking about that lipid package. It's basically like a little glob of fat that the mRNA is sitting in. The mRNA research and that lipid fat research, which again, I'm just like really BC centric today, but that lipid fat SAC was developed here in BC. Those things had been under investigation, had been in research for decades. So basically it was kind of the tail end of that was fast-tracked with resources and collaboration, but every step of the safety pieces has been followed. And what's really cool too is that what's also been fast-tracked is our monitoring for rare but serious reactions, right? Marcia said close to 7 billion doses. We've never been in a situation where we've been able to monitor in real time in the real world at that scale, monitor for rare but serious consequences or adverse reactions. So we like really know that these medicines are safe. Like we just really do. There's no other way to say it, just because we've been watching it now for several months.
I'll just add, I listened to a podcast months ago about one of the scientists who worked on the mRNA technology. It was fascinating. It was on the Daily, but also I recently read this article in Nature. I know you're not going to be able to see it, but the Nature journal called The Tangled History of mRNA Vaccines. That was published in September with some updates in October. And it really is about the hundreds of scientists who work for decades on the mRNA technology. So just to add, there are some really good resources out there for people to look into if they want to know more about the history of the mRNA technology and how that lends to the safety of the vaccine.
That is a beautiful comment to add in there. It's not new technology, right? Well, this has been being developed over a number of decades. Dr. Adams, I'm coming back to you, just picking up on the, it's not about me, it's about we. And that brings me to the importance of the partnerships that we have seen throughout this pandemic. From a national perspective, How important have those partnerships been in the biggest fight in our generation?
Yes, I often hear arguments to do nothing. I won't play because the situation is not perfect. And that is never a good stance. For instance, the government is bad. So anything they say, I will completely disregard. Or doctors are bad. So I won't hear them. That's just a little too simplistic and pat. And there are very important conversations that we can have around even simple things like having to remind people, Marcia and I and Danielle and you, Marion, and many others, we're trying to do good things, not bad things. We're not trying to harm you. We're not trying to encourage you to do something terrible to your body or to your family. We're really using all of our energy to do well. And partnerships, we see time and again, whether it's in Manitoba or in BC, where First Nations leaders and First Nations healthcare workers and the province and the federal government and its many entities, if they can cooperate to roll out these enormous actions, that's way better than when one ignores the other or doesn't take the other into consideration. And we've seen examples of that. We've seen failures to communicate, and hopefully we're learning from them to say, we can cooperate for the betterment of everyone. And it's really as simple as believing that the person next to you also wants to do good things for others who are around them. And I'm not sure why that's so hard to believe for some people. I don't know what's happened to them, but they think that. And yeah, so I know I can look at my colleagues, and that's really important, and say, I absolutely trust you. So, Marcia has knowledge that I don't have, Danielle has knowledge that I don't have. So if they can say to me, that's being worked on, or that's been decided, and here's a direction to go, I'll say, okay, I trust you. Let's go, because we have a common goal to help the people, to protect our nations.
Thank you, Dr. Adams. And we are at that time, folks. Can you believe that we unpacked 2 hours of information on Town Hall number 50 of COVID-19 trusted, credible, and reliable information? Don't go to Dr. Google. Don't go to Dr. Facebook. Go to the trusted sources, and we've brought them for you today. Dr. Adams, a final comment?
Oh, I was so wanting to ask you all about respect, because some of my colleagues have said that recently they were challenged, by people in front of them, and they felt disrespected. And first I was shocked, and then I realized that I had to say, let's all be kind to each other. Unvaccinated people are not going away. COVID is not going away. We need to get along within our families. And you've given us some great information, but I think most importantly, you have shown us, and I include Dr. Richardson in this, who unfortunately had to go and do some other great work, that we've shown the spirit of collaboration and warmth and collegiality and respect. Thanks.
I really appreciate the time that we got to spend together. I cannot thank you enough for the service, for the teachings, for sharing your knowledge. I know you guys are exhausted, and just know you have a collective we standing behind you with just true gratitude. Thank you. And for those who weren't able to make this viewing today, we are recorded, so you can still see this and share it to all of your kins across Turtle Island. And I want to share with you that our Facebook partners were the FNHMA Facebook page, APTN, Indigenous Physicians Association of Canada, MBC Radio, Co-op Radio, The Wolf 95.7, CKLB, Element FM in Toronto and Ottawa, CFNR, NCI. I love you guys in Winnipeg. Thanks for broadcasting us. Nation News, Alberta Native News, we love you as well. We also thank First Nation Drum, Anishinaabeg News, Eagle Feather News, and we will, so stay tuned, we will have more rebroadcasts on some of those radio stations at a future date in the next couple of weeks. And I'd be remiss to not mention, if you want to join the First Nations Health Managers Association in our Rise Against Racism, November 3rd is the date from 10 to 4 p.m. Eastern as we talk about anti-Indigenous racism in the healthcare setting. A huge thank you to our physicians. Thank you so much. Really appreciate you. Merci beaucoup, Richard. Merci, Pascal. Thank you to Nation Talk for making a miracle happen at the last moment. We appreciate you. Indigenous Physicians Association, you have our love and gratitude. Until next time, stay tuned. We might bring more information, but be safe, be healthy, and be well. Hi, hi.